Welcome to another exciting episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor, and each and every time we get together, we bring to you information that literally is life-changing, compliments of our friends over there at the HSA. And this time we're talking about Diabetes Awareness Month. Now, I know this is a situation where a lot of our West Indian folks, they call it sugar, they call it all of these other things, but the official title of it is Diabetic Awareness Month. And I have with me here diabetic educator, Miss Winsome at Jefferson. Good morning. How are you?
Good morning. I'm doing well.
So let's just jump right into it. What's the importance of a diabetic awareness? Is it diabetes or diabetic awareness month?
Diabetes
Awareness Month. Tell me the importance of that.
Okay. Every year on November 14th, we observe World Diabetes Day. What happened is that diabetes is a very prevalent condition. It affects 537 million persons worldwide, which represents 1 in 10 persons having diabetes. And even here in the Caribbean and the North America region, 51 million persons have diabetes. So you can see it's very prevalent, and a lot of persons, take it very lightly.
Mm-hmm.
As my host, as was said,
mm-hmm.
Persons will say, well, I have a little touch of sugar,
mm-hmm.
and really downplay it.
Downplay. And see, once again, folks, if you're just tuning in, welcome to another episode of Healthcare Today with HSA. My name is Chuck Taylor, and we're talking about the importance of being aware of Diabetes Awareness Month. Now, we're talking here with diabetic educator, Miss Winsome Jefferson, and she was just going over the importance of it. And sorry for interrupt, Miss Winsome, but we always hear, I have a little touch of sugar. Like it's a small thing. They really downplay the fact that this is something that can end your life. This is something that can debilitate you. This is something that can change your world in a matter of minutes.
That is true. Because the thing about diabetes is that it doesn't present itself as something very severe, because persons are not having sharp pain, they're not having heart palpitating, they're not having symptoms like that to say that, hey, something is happening.
Mm-hmm.
It's usually very, very, not insidious, but it is a condition that doesn't really push persons to come to the doctor until their blood sugar levels are so high. Some persons even up to 900, and then they feel as if they're going to die. They feel as if, some persons might get bad vomiting, and usually that is when it is really, really severely high,
mm-hmm.
and persons, end up being admitted to the hospital unnecessarily. Not only that, because blood sugar levels it's not very obvious to persons. Persons' blood sugar levels could be high and they don't know, because a lot of it is hereditary. A lot of persons
mm-hmm.
have it in their family history, and of course, based on eating as well, predispose persons to diabetes. But diabetes can actually affect the eyes and lead to blindness.
Loss of vision.
It can affect the kidneys and lead to kidney failure and dialysis.
Wow.
It can affect the heart and lead to heart failure later on. It can lead to amputation. So it's not something to take lightly.
Mm-hmm. On average, what should our sugar level be, just as a normal person? Because you said that high is 900. On a normal person, and of course we know normal can range a little bit, but on average, what would be a normal count for a person?
Right. So on average, fasting blood glucose, which means the blood sugar levels in the morning before you eat, it should be more than 80 and less than 130.
Wow.
And 2 hours, and that is used in the milligrams per deciliter range. Some persons who have a blood glucose machine that uses millimoles, it should be more than 4.4 millimoles per liter and not exceed 7.2 millimoles per liter. That is in the morning before eating. And 2 hours after eating, the blood sugar levels should be more than 80, but it should not exceed 180.
Wow.
Preferably between 80 and 160 for for a person who doesn't have any diabetes at all. Right? The guidelines, the references say it should not exceed 180 after meals, 2 hours after meals.
180. And you're saying that people come in with as high as 900.
Believe it or not.
That's 9 times the limit that you just told me, literally.
Right. And I have seen somebody with 2,000, and I didn't know that it was even possible. Somebody who was admitted to the critical care. I didn't know it was possible for the blood sugar levels to even go so high without getting into a coma.
That's what I was just about to say. You're talking just the risk factors of it. You can go into cardiac arrest. You can go into coma, sugar-induced coma. You can lose limbs. This is not something to be taken lightly at all.
That is so true. The thing about it is that persons are not immediately going to go get their feet amputated, or they're not going to immediately get kidney failure. But the thing about it is that persons can have their blood sugar levels high and not realize it. And if it keeps being high in the bloodstream, over the years, the kidney function starts to deteriorate, and can lead to kidney failure.
Okay.
And the same thing with the eyes as well. It is not something that is immediate. But if the blood sugar levels are elevated over the years, if it is constantly elevated and not being controlled, the eyesight can deteriorate and lead to blindness. And the thing about, we're talking with the amputation as well, when the blood sugar levels are elevated constantly over the years, what can happen is that it can start to affect the nerves in the feet. And so persons can start to lose sensation in their feet. It can affect any nerve in the body if it is elevated over a period of time. But the feet are usually susceptible because in diabetes, the blood sugar, the circulation to the feet is reduced. So that in combination of the blood sugar levels being elevated over the years,
okay,
the sensation in the feet gets less. And so somebody can, they can cut their toe
and not
realize it because they're not feeling the sharp pain that the nerves usually cause the body to experience, as a protection, right? I remember this gentleman who had diabetes for many years, which was uncontrolled, that there was some sand in his shoe, some gravel, and he didn't feel it.
Wow.
And he was walking around in the shoes, and his foot bottom became so infected that the doctor had to pare away some of the flesh.
And that was because he lost the sensation and didn't realize that had a cut or a traumatic something to that foot.
Exactly. Wow. So one of the things I even tell, I do a diabetes education clinic at HSA. One of the things that I tell my patients, those that are diabetes, I say, each time you bathe, it's very important for you to check your toes, check your foot bottom, dry between the toes.
Check everything.
Always check it routinely after bathing, so that if there's any little cut, any little bruise, any little corn, it can be nipped in the bud.
Right, early before it becomes
an issue.
Because, in folks, you have to understand, as we're talking here about Diabetes Awareness Month, just imagine you have a slight cut and it keeps bleeding overnight and you have no knowledge of this. You're going to lose blood susceptibly till literally you don't know this.
It will become infected.
Right. Wow.
And then when it becomes infected, it is harder to treat when the bacteria multiplies. And, persons don't realize, or some persons don't realize, or they might use some home remedy, so it's not really a big deal, and the infection is getting worse.
Right.
And
it spreads.
It spreads, and it is much harder to treat when the bacteria has multiplied so much in that particular affected area, and because the blood flow to the extremities is reduced, it is fighting, really, really, really fighting to save that toe or that limb.
Mm-hmm.
Right.
Wow. If you're just tuning in, this is Healthcare Today with the HSA, talking with a diabetic educator, Miss Winsome Jefferson. My name's Chuck Taylor. We'll be right back, and we're going to be talking about, we started to allude to it, but we're going to go back and discuss some of the risk factors of diabetes. We'll be back in just a moment. Keep it right here on Bobo 89.1 FM.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Thank you for tuning in to Healthcare Today with HSA. I'm your host, Chuck Taylor, and we're talking about Diabetes Awareness Month. In-house with us, we have our diabetic educator, Winsome Jefferson. She's talking to us about everything that is diabetic because, people, and I want to say, because of our West Indian culture, we tend to downplay it quite a bit. And we call it different names to make it sound not so clinical. We say, oh, it's a touch of this. I've growing up, I never knew what sugar was. I was afraid of sugar because of the words, oh, don't eat too much sugar because you might get sugar. And I'm like, what was that? And then during the course of time, I realized that, it's diabetes. And how prevalent is that in our community? Before we get into the risk factors of it, being in the West Indies, being a person of color, how prevalent is that in our society?
Okay. There was some research that was done some time ago, and the prevalence in Cayman is somewhere between 6 and 8%.
Mm-hmm.
And generally in the Caribbean, between 6 to 10%.
Wow.
Right? But when you multiply the numbers, it's quite a large number of persons. And that survey was just an estimate as well. There are so many persons, who were not included. So it is something it is prevalent in the Caribbean generally.
Right.
And it's very prevalent among African Americans, among persons of color.
Mm-hmm.
And what happened is that because it's also prevalent among East Indians, Asians as well, because it is prevalent, because it is a genetic, part of it is genetic. Type 2 is genetic.
Okay.
Right? And I'll explain what type 2 is. There are 4 types of diabetes.
Okay.
But because it is genetic, persons in the community who have it in their family, they are high risk of getting diabetes. So if the person consumes foods that are high in sugar or high in carbohydrates, if they're overweight and if it's in their genes, they are very high risk of getting diabetes early. You have some persons who get type 2 diabetes as early as in their 30s.
Wow, that's quite young.
Right. And persons who are overweight, they are even higher risk, than the regular population. But not just persons who have it in their genes are susceptible, but persons who consume a lot of, sodas and sweet treats,
Refined
refined
sugars.
sugar, and also eat a lot of carbs,
Hmm.
they are high risk of getting diabetes. But there are things that can be done to prevent it and to delay it as well.
Okay. With that being said, let's talk about some of the risk factors of diabetes, and then we can talk about some of the symptoms of it and work our way from there. So, what are some of the risk factors of diabetes?
Right. So, as I previously mentioned, one of the risk factors is actually having it in your family. Your mother, father, aunt, uncle, grandparents, that is a risk factor already.
Mm-hmm.
Genetic component. Another risk factor is race, as I had mentioned. Persons who are Negroes,
Mm-hmm.
they are high risk. Persons who are overweight are high risk, and especially if you have a big BMI, if you have a big waist, or have a big tummy, big
Mm-hmm.
abdomen,
You're right.
yeah, that can lead to insulin resistance. So that is also a high risk.
I never heard of that before. That is so. Wow. Okay.
Yes, when you have a fat around your waist, it increases insulin resistance. So the insulin that your body produces don't work as effectively in lowering the blood sugar levels.
Okay.
Because what happens is when you eat food, it is broken down to sugar in the blood. So after you eat the food and this is digested by the enzymes, it is broken down to the simplest form of sugar, which is glucose, and then that gets into the bloodstream. And what happens is that the insulin is produced by the pancreas that is located near to the stomach, right? And insulin, what it does, it facilitates getting out some of the sugar out of the bloodstream into the muscle cells and the fat cells. And some more of the sugar goes to the liver where it is stored as glycogen. It is stored as a reserve for the body,
Mm-hmm.
right? What happens in insulin resistance? Insulin is produced, but it is not effectively getting the sugar out of the bloodstream into the muscles,
Okay.
right? So the muscle cells are not as susceptible in getting the sugar up. So the pancreas is producing more and more insulin,
But it's not using
but it is not being effectively used up by the muscles because the sugar gets into the muscle cells to provide energy for the body.
Is that one of the reasons why diabetics always have low energy? Their muscles, they can't move in that because the
Exactly.
okay.
The sugar is into the bloodstream and it's not getting into the muscles
Okay.
because there is not enough insulin on board or there is not enough exercise to get the sugar into the bloodstream, or there's insulin resistance and the person needs to be on medication to facilitate that process.
Okay.
So the sugar is in the bloodstream. So they are very weak
Mm-hmm.
because it's not into the sugar
It's
getting
not
into
getting
the
into the
muscle
muscle.
where
It's
it needs
there,
to provide energy.
it's just not being taken by it because it's not being
It's
pushed.
not taken up by the muscles,
Okay.
muscle cells, because of the low insulin or the insulin resistance that
Okay.
is there.
Wow. And one of the things that you always hear about is, and mind you, I'm talking as a person who, let's just say we have a history of diabetes in our family. We've had 2 or more members, aunts, uncles, cousins, but are we susceptible to it also?
Right. So you're susceptible to it. The best thing to do because after you reach like in the 30s, 40s,
Mm-hmm.
right? One of the things that can happen is, well, the risk gets higher as you get older, right? It is good to get tested
Okay.
so you know exactly what your blood sugar levels are. There's a blood test in the lab called HbA1c. That blood test tells you whether or not you are either in the pre-diabetes range or you are actually diabetic and don't realize it, right? And so that HbA1c for pre-diabetes, okay, let's start with no diabetes at all.
Mm-hmm.
No diabetes at all, it is less than 5.7%. This is a lab test.
Okay.
Between 5.7 and 6.4, that is pre-diabetes, and 6.5% and over, that is diabetes. So it's good to know your status.
With that, with the test, and we, after, I would say, based on what you're saying, 30, 35, we should go in and get this test, because you're starting to get to that age to be exposed to.
Yes, your risk increase. What I would say, at least persons who are in their late 30s who are overweight,
Mm-hmm.
right? You might have persons who are not overweight being more susceptible, in their 40s and upward. But if you have it in your family, a good idea is even to get tested from even in your late 30s
Mm-hmm.
to see where you are along the spectrum, so that you can take steps to prevent the diabetes or to delay it.
Mm-hmm.
Right? Over 10 years ago, I have it in both sides of my family.
Okay.
And it just dawned on me very suddenly 10 years ago that if I don't change my diet, I am very high risk of getting diabetes early.
Mm-hmm.
And so what I did was to change my diet. So and to be honest, I have been in the pre-diabetes range for the past 10 years, right? Doing everything with diet and exercise to prevent getting diabetes. My father got diabetes in his late 30s. My mother got it at 58,
Wow.
right?
It's a 20-year difference.
But because the thing about it, why some persons can say, okay, I get a touch of diabetes. Let me explain that.
Mm-hmm.
Just like even with the flu, let me use that as an example. Some persons can get the flu, right? And they have mild symptoms. They might have coughing, running nose, sneezing,
Mm-hmm.
right? Another person can get the flu. They have a very high fever. They have very bad pains all over their joints, along with the coughing, sneezing, and so forth. So it is similar with diabetes as well. Some persons can get diabetes, but they get a real, let's all call it a good dose or a bad dose
Right,
of
a
it.
bad dose of it.
Let's
For lack of another term.
lack of another terminology.
Right. Mm-hmm.
So my father got it early in his late 30s.
Mm-hmm.
And it's like, well, he got like probably what I would say a good dose of it,
Mm-hmm.
right? Fortunately, he found out early enough, going to the doctor, and he was put on medication to control the blood sugar levels. He was put on tablets, right? But fortunately, he was advised, to change his diet, and we'll talk about diets a little later,
Okay.
and exercise, and he took that very seriously. So he changed his diet, he exercised, but because he got like a good dose of it then, he had to be on tablets. And then as time went by, he had to be on more medication to control the blood sugar level because it was progressing.
Mm-hmm.
And then, in his early 70s, he had to be put on insulin to control the blood sugar level. Because the most important thing in diabetes is for your blood sugar levels to be controlled throughout the day. Because that is what will help to protect your eyes, your kidneys, the nerves in your body, and so forth.
Mm-hmm.
So when he died at 83, His eyes were not blind. His kidney had not failed. He did not develop any heart failure, but it's the choices that he made.
Okay.
Right? My mother, on the other hand, she got it at 58. Of course, the doctor advised diet and exercise as well, and she was very meticulous with that as well. But she only had to take one tablet. So even though she's 90 now,
Right.
one tablet controlled it.
Right.
So
it's varying different depending on your body structure and depending on how severe the diabetic, call it episode for lack of another word, happens to you. It can vary in what is required to treat it.
Right. That is true. But whatever it takes, the blood sugar level should be controlled, and that is what helps to prevent the complications of it. Right? Diet and exercise is always a part of the equation. But medication might be needed. Some persons, they're only using, bush or supplements and that kind of thing. I don't advocate, if your blood sugar levels are high, I don't advocate just using diet and exercise with herbal medicine alone if that is not controlling it through the day. It is best to go to the doctor.
There needs to be a more aggressive approach to it so that you can be in control of the blood sugar level. So with that being said, what are some, you alluded to some of the symptoms. Give me some of the symptoms of diabetes. We started touching that on a little bit, and then we can go into, the changing of a diet, because you said two things that's always key is the diet and also exercise. So we can approach that, have a conversation about that. If you're just tuning in, welcome to Healthcare Today with the HSA. I'm your host, Chuck Taylor, and I'm talking with a diabetic educator, Mrs. Winsome Jefferson. She is going through and giving us a very unique and broad view of it. Of course, this month is Diabetic Awareness Month, and Monday, November 14th specifically, is Diabetic Awareness Day. So we'll be right back, and we're going to talk about some of the symptoms of diabetes on Bobo 89.1 FM.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's Cardiology Clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
We are Bobo 89.1 FM. Welcome to Healthcare Today with the HSA. I'm your host, Chuck Taylor, along with diabetic educator, Mrs. Winsome Jefferson, as we talk about Diabetic Awareness Month. And November 14th is World Diabetes Day. And, that's right around the corner from today. So this information is timely and very well warranted. Tell me some of the symptoms of diabetes.
Okay. So excessive urination is a symptom. What happens is that the body is actually talking to you and saying, hey, there's too much sugar in the blood. I need to get rid of the excess sugar. And so that person will find themselves urinating quite frequently, right? And then because the sugar is passing out in the urine with water,
Mm-hmm.
the person becomes extremely thirsty.
Okay.
And so they'll be drinking a lot of water, or in some cases, the person that I had mentioned that was, those blood sugar levels went up to 900
Mm-hmm.
or under 2001 as well. What happens to a lot of persons is that because they're drinking a lot, they're thinking it is because they're drinking a lot why they're urinating so frequently.
Oh,
But
okay.
in diabetes, it's the other way around.
You're drinking because the body's craving.
Because there's excess sugar in the blood,
Mm-hmm.
the body is trying to flush out that sugar
So you're
in the
thirsty
urine.
all the time.
And because the urine comes with water,
That's
You
how
know,
the body's doing it.
you are so thirsty, And so some persons who don't even realize what is going on, they are drinking Gatorade and juice, and it's making the situation worse.
Right.
So when I had spoken to that person, whose sugar had gotten so elevated, he did not know he was diabetic,
Wow.
right? And because he was so thirsty all the time,
Mm-hmm.
drinking a lot of water and juice, and then he was
He's thinking,
feeling,
I need to put in electrolytes. I need to put in all of this other stuff.
I'm just so thirsty. I need
Right.
to grab anything that I can to drink, right? And then if I drink Gatorade, it's supposed to give me more energy as well, because what was happening with him is that he was feeling weak and he was very thirsty as well. Okay, so let me drink a lot of Gatorade. Gatorade is loaded with sugar, right? Let me drink some juice. Juice is, supposed to give me energy. And then it was making the situation worse. The sugar's getting higher.
Wow. So it's a bad circle that continues on, and your body's telling you one thing, but you don't know how to read it to see that there is an issue, a
Exactly.
problem.
So if you find yourself urinating much more frequently than usual, it's really best to check it out to see, hey, what's happening? Especially if diabetes is in your family or you're overweight, it's best to just check it out, right? So another symptoms is that some persons have weight loss, constant hunger, because, the body is saying, I'm eating all of this food, but it's in the blood. It's not getting into the muscles, right? Some persons get a tingling sensation or numbness in the hands or the feet. Blurred vision can be one of it as a sign as well. Frequent infections, getting a yeast infection, getting a cut, having a cut that, is slow to heal.
These are all signs and symptoms
Yeah,
of
slow healing wounds.
Slow healing wounds of diabetes. And this is something that you should take notice of. It's nothing to be dismissed. Anything happened to you, please, please, please go to your healthcare professional over at the HSA and have this looked at, because you don't know, your body's telling you things, but you don't know how to read the signs of it.
Exactly.
And I think that is a starting point. As she said, diabetes often target organs, but that's later on. But these are some of the symptoms that happen beforehand that you can realize and say, something's not right about this. I should go get myself checked about. Is that correct in saying that?
Exactly. Experiencing any of these signs, 1, 2, or 3 or more, just check it out. It's always best to know what's going on. It could be nothing, but it could also be that
Something severe.
you have diabetes. And then, as I had mentioned before, it is something that can be controlled. So you can live a healthy, long, normal life if your blood sugar levels are controlled. As I like to I refer to my father because I find him to be a very good example. Even though he had diabetes bad, because of the diet, exercise, plus taking his medications regularly, going to the doctor, doing the regular blood tests, you know. I think it was for him, I think it was like twice per year, right? Because of that, he could retire at 65 and still get a 10-year contract with the government to continue working.
Right.
Right?
Because
So-
he was healthy enough.
Because he was healthy enough to function, because his blood sugar levels were controlled. So persons can live normal lives with the diabetes if they put the right measures in place. And that is what I really want to bring across very strongly to the listening audience.
That you need to take care of it beforehand to continue living a normal, healthy life with this. It's not that you wake up one morning and it's debilitating. It builds over a course of time to targeting your organs. We're going to come to that in a second, but it just doesn't happen overnight. This is a building that you need to notice these signs to say, hey, something isn't right. I need to do this. And once you start on it, you need to continue on a regular maintenance of your body to make sure that you control it. Because once it gets out of control, it's out of control.
Right. So the lifestyle modification, very important, the diet and exercise. And the thing about it is that, persons, when they're on the medication, it's very good to, to continue with the medication. Sometimes even when you're on the medication, it can get extremely high. Like, if persons have an infection, the body is very stressed.
Right.
Or a stressful situation, can also cause the blood sugar levels to increase. But that can be dealt with and, goes back down to normal. So it's very important to follow up with the doctor and to continuously take the medication.
Okay. With that being said, let's talk about what you just said. Our listeners, advise them on how some of the affected organs and complications may develop as a result of not taking care of themselves. In other words, not seeing the signs, not being on medication. Some people, I don't want to take medication. I'll rather use and once again, folks, we advise you always see a professional concerning this. Always seek out the knowledge and also be aware of what your body is telling you. So with that being said, give me some information about the affected organs and some of the things that can arise from complications developing as a result of being diabetic and not taking proper care of yourself.
Okay. So one of the things that can happen is something called diabetic retinopathy. What that is, in essence, is that the blood sugar levels can affect the very fine blood vessels in the back of the eye. The retina is at the back of the eye, and that is what guides sight. So the back of the eye, there can be bleeding because when the sugar is elevated.
Okay.
And persons might not even realize it. You might see a few lines of red in your eye, but you might not even realize it. But there's a problem with the vision, and they have to go to the ophthalmologist, the eye doctor, to get that sorted out. It can be dealt with, but it's really best to prevent that from happening.
Right. Prevention is the
Prevention
key.
is better than cure.
About.
And as I'd mentioned before, it can affect the feet and any nerve in the body. So it can cause diabetic neuropathy, which is the damage of the nerves. So it can affect any nerve in your body, actually, right? The feet are targeted, as I'd mentioned, with the combination of the reduced circulation to the feet, plus the loss of sensation, right? So that predisposes persons to amputation because of the lack of sensation. They can get a cut and all of that. Heart attack and stroke is something that can happen over a long period of time.
Right.
Also, kidney problems, which is known as diabetic nephropathy, right? The kidney function can deteriorate over the years and lead to kidney failure and dialysis. And, we don't want that. It can also affect the mouth. It can cause gum disease, all right? So it's very even important for persons to visit their dentist at least once a year. Persons with diabetes is also very important for them to see their ophthalmologist, the eye specialist, at least once a year to check out the eyes thoroughly. Because when the blood sugar is controlled, as I mentioned, it can prevent the diabetic neuropathy. Some men can even end up with impotence because it can damage the nerve that causes that is responsible for an erection. So it's really very important to get tested, and if you are diabetic, take your medication along with diet and exercise, and those complications can be prevented. I want to state that very clearly. If you stick to your diet, be active, and take your medication as the doctor prescribes, continue with your appointments, whether it is every 3 months, just be on top of it, and you can live a healthy, long life free of the complications of diabetes, because that is really the serious part.
Understandable. We were talking about foot care, the essential of it, and how important it is that the smallest cut can produce such serious consequences with it. What are some of the treatment and support services available at the HSA for diabetes? I mean, one of the things that I always say is you got to kind of teach people how to take care of themselves when they hear that they're sick, because most of us immediately, I'm sick, I don't know what to do. And sometimes we forget common sense and things of that nature. So how is HSA services and treatment available for people who experience diabetes?
Right. So we have general practitioners, right? So we have a GP clinic where you have doctors that are knowledgeable about diabetes. And so persons can make an appointment at the GP clinic to see a doctor. We also have internists, right, at the specialist clinic that they're very knowledgeable about diabetes as well. So they can also help patients to control their diabetes. And I, as a diabetic educator as well, I do a diabetes education clinic on Tuesdays and Thursdays at the general practice clinic between 2 and 5. So I also help to empower persons, educate persons about diabetes as well. Okay. Different steps that they can take to get their blood sugar levels be controlled.
Mm-hmm. And with that being said, once, let's just say, all right, I'm Chuck Taylor, and I find out that I have diabetes. Lifestyle choices and changes after that. Walk me through what I should do to change my lifestyle, because as you said, you and I use your father as a good example. You said that he immediately changed lifestyle, eating, exercise. Walk me through some of the lifestyle choices with somebody who may be a high risk of getting diabetes to lower that, or maybe somebody who has diabetes to keep it in check and to keep it lowered where it's able to be a functioning person.
Okay, let's start with food. Okay, there are some foods that you should avoid. If you are high risk for diabetes, if you're pre-diabetic, or if you're diabetic, and generally speaking, if you want to keep healthy, it's good to avoid foods that are made from white flour. So that includes like white bread and cake and bun and bulla,
Dumplings.
patties,
Yeah.
dumpling that is made from white flour. Right? There are better choices. Foods that are high in fiber, when they're digested, it prevents the spiking of the blood sugar levels. So the whole wheat bread or the whole grain bread, whether it's a 9 grain, 12 grain, 15 grain bread, or any bread that contains at least 2 grams of fiber per serving is very helpful. If it's dumpling, it's best dumpling that is made from wheat or wheat plus cornmeal.
I was just about to say that, you know. So two things. Look for food that is away from the pure white color. I'm trying to simplify it a little bit, but you're looking for more grain orientated food and also grain orientated flour, pastries, things of that nature.
Right. So, the brown rice, the parboiled rice, bulgur, quinoa, those are healthier than the white rice. And also, even with the pasta, the whole wheat pasta or the vegetable pasta is healthier than the white.
Right. And this, it's funny you should say that, because I think as a Caribbean Cayman society, we didn't have access to this years ago. Now I see it quite often on the shelves in supermarkets and just on the shelves and even at the gas station and things like that. You see alternatives to the white flour, I call it. They've incorporated it, making it a lot easier to find. Also, when you go eat out, they ask, do you want this? Or you'll see a different menu, and say a whole grain and things like that. So society is opened up, may not be knowledgeable about it, but they've opened up more to that.
Much more options, much more options. Because as I mentioned, even some persons are not familiar with spelt flour.
Okay.
But spelt flour is actually a multigrain flour. And I even tell persons that, if you like to bake and you are diabetic, it's a healthier choice to the white flour. So the spelt flour, you can make your muffin or your cake, along with, sugar-free.
Right.
There are sugar substitutes, and there are several sugar substitutes, right? Because if you're diabetic or high risk for it, it's really best to avoid granulated sugar, honey, brown sugar, condensed milk. But you have good sugar substitutes. You have monk fruit, Equal, Splendor, Truvia, Stevia. So you even have choices if you wanted to make like an oatmeal muffin or a blueberry muffin. You can incorporate the spelt flour with the Truvia or Stevia to sweeten it. So you can still, make foods that you can eat and enjoy as well, even with being diabetic.
Right. And I think that was one of the things I remember growing up. A lot of diabetics were very, I can't have this anymore. I can't have this anymore. I used to love eating this cake. I used to love eating this. But the change is you can still have certain things, but just in a different way.
Exactly. What was very interesting is last year I decided to make a Christmas cake. And I have the recipe for it. I have a very good recipe for it. But I decided to use some of the spelt flour. But it was several cakes. It was about 6. But I decided to incorporate spelt flour along with a small amount of white flour in the recipe. And I also substituted a lot of the brown sugar with the Truvia, right? There was still a little brown sugar in it. And what was so amazing, of course, the fruits as well. What was so amazing is that persons could not tell the difference
Right.
between a regular fruit cake and my cake.
And your cake.
Right.
Which was a lot healthier for people with diabetes.
It was a lot healthier, but just as tasty.
Mm-hmm.
So there are choices, right? And another good choices that we have here in Cayman, in the Caribbean, green banana, yam, plantain, sweet potato, cassava, pumpkin with the skin, breadfruit, cocoa. All of those things can be eaten,
Right.
right?
But you don't think about it as, oh, that's more to help with my day. They're good fruits.
They're good ground provision. You know, the thing about it is that the portion, of course, is very important. If you eat too much one time,
Mm-hmm.
then it can cause your blood sugar levels to be elevated, right? But if you have a portion, like, say, as a guide, I usually say, like, 4 pieces,
Mm-hmm.
like 2 green banana with 2 finger green banana, with 2 pieces of yam or sweet potato or a large sweet potato, or a large sweet potato,
Mm-hmm.
along with the vegetables and your meat kind,
Right.
and you have a portion of that for lunch or another portion for dinner. So you don't have a lot of carbs one time.
Mm-hmm.
You
Because
know?
that's going to spike your sugar level.
Exactly. When you spread out your food, you get better blood sugar control.
Okay. And folks, if you're just tuning in, we're talking to diabetic educator, Mrs. Winsome Jefferson. And we're just kind of getting set to wrap up, but talking about lifestyle choices and changes to help reduce someone who is a higher risk or someone who has been found out that they have diabetic. So with that speaking, let's just say I found out that I'm diabetic and I decide to, I need help understanding this. And I want to attend a diabetic education seminar with you, a session with you. How is that going to work out? Tell me how I can get involved with that, and also just to help people who are labeled as diabetic. Like, I just found out, this week that I'm at risk. How can I meet with you or get with you to have a session and talk about this, what we're hearing about today?
Okay, so the diabetes education clinic that I run, it's, as I had mentioned, Tuesdays and Thursdays between 2 o'clock and 6. Now, appointments can be made through the general practice appointments, 244-7683 or 244-7520. Appointments can be made by calling any one of these numbers or actually coming in person to the general practice clinic and making appointments, right? I wanted to mention something very important about just about foods, just to add very quickly.
Of course.
All right. Sodas and juices, you have to be very careful if you are diabetic or if it is in your family, right? What there's a guide that I suggest. The sugars per serving should not be more than 10 grams. So, for example, if you're having apple juice, right, a glass of look on the labels. That's what I would say. Read the ingredients. Apple juice. When I checked one of the apple juice in the supermarket, the serving size is 8 ounce, which is a regular 8 ounce glass, contains 27 grams of sugar.
What?
So if you're going to be having apple juice and you're susceptible, it's best you have like 1/3 glass. It can be diluted, or you can drink the 1/3 glass and drink a glass of water. Orange juice, one of the brands, 22 grams of sugar to the glass.
That sounds like a lot.
Yeah, some sodas, 30 grams. Some juices, 30 grams of sugar. So it's very important to look on the labels so that you can reduce the amount of juice and dilute it so you don't have the spiking of the blood sugar levels. Right? Same thing with sodas. Well, sodas, some of it is even 40 grams of sugar.
That's
really,
a lot.
It's really best to use. Well, the diet sodas are better options with that. But vegetables is what you cannot have a lot of. And even some vegetables, all vegetables are good, right? And some vegetables are even super vegetables. They actually lower blood sugar levels as well. String beans, okra, Brussels sprouts, bitter melon. Those can even actually lower blood sugar levels as well.
Okay, excellent to know.
And cinnamon is also good as well.
Excellent. And this is, folks, as we get set to wrap up here, don't forget World Diabetes Day is happening on Monday, November 14th. I know it's a holiday here in the CI, but the world is recognizing it as that day. And for those people who have diabetes and have been diagnosed on it, this is basically to help you extend your life. This is real talk about things that are going to be beneficial for you so that you can have a long and productive life, reducing your risk and also improving your health. We want to thank you so much for talking with us. And finally, if someone needs to get a hold of you, just tell them the days of the clinics and the times and how to reach out again to you.
Okay, I'd like to mention something as well. Next week, we'll be having some talks on diabetes in the clinics as well. So on Tuesday, we'll be doing a talk at the clinic in Northside, right, at 10 o'clock. I'll be doing a talk along with one of the doctors from the hospital, Dr. Movin, right? Wednesday Specialist Clinic, there'll be a talk as well at 10, and at West Bay 2:30, there'll be a talk in the clinic, so persons can even come out to get and to hear about it and get some handouts as well. Make appointment to see me in the Diabetes Education Clinic if you want one-on-one information about diabetes as well. Tuesdays and Thursdays, I do it between 2 and 5. There are appointments, and the appointments can be made through the General Practice Clinic at 244-7520 or 244-7683.
Okay.
Thanks for having me.
Thank you so much. You just heard another exciting episode of Healthcare Today with the HSA, talking with a diabetic educator, Winsome Jefferson. Thank you so much for stopping by here. We'll talk to you soon. Keep safe, K-Man, and always keep it tuned right here to Bobo 89.1 FM.